When people find that they have no jobs, no prospects, they can't pay their rent, they can't pay their mortgage, their businesses have collapsed, their children have no future, they themselves have no chance of anything approaching a job resembling what they used to have, when they find out that the country is immensely poorer, that the National Health Service, which they bang their pots and pans for in March, April, and May, is a shriveled shadow of its former self, and so are all the other public services, from the railways to the schools. When they find out what has been done to them by these buffoons, I think there will probably be a considerable political revenge. The fundamental question from the beginning was one of proportion. Was the action proposed by the government, more or less a strangulation of the economy, a throttling of the National Health Service, an increasing attack on personal liberty, was it justified by the threat? It's a question that COVID-19 is a disease from which people die, but were they dying or likely to die in the quantities predicted, particularly by the modelling of Imperial College, which had a poor record of modelling in the past, I have to say, which was easily discoverable? Were they, in fact, preventable deaths in the way which the government proposed to prevent them? Were the measures, as I say, remotely in proportion to what was proposed, and did they work? And I think the answers to all those questions appeared to me at the time to be no. And I don't just take this view plucking it out of the air. I was particularly impressed by what was said by a very distinguished professor of microbiological medicine, Sutrit Bhakti of the University of Mainz in Germany, whose writings and speeches of the time now read like prophecy, who said that this was the most terrible mistake, an overestimation of the danger, and would be bound to do particularly very grave damage to the healthy and old, which of course it has done, and to society in general, and was unjustified. The work of Professor John Ioannidis of Stanford University, who immediately spotted that the alleged levels of mortality being predicted were simply didn't accord with what we knew about the way the disease had behaved. And also very early on, the work of which the Financial Times, to its credit, picked up at the time, the work of Sunetra Gupta, another resident of my great city, Oxford, who was highly skeptical about Imperial College's idea of just how vulnerable the population would be to the disease. And then if you follow through the succeeding months, as I have very carefully, the actual figures of deaths and the nature of them, and you find that the supposed pandemic is in fact largely a statistical matter. But if it hadn't been for the government's incessant promotion of deaths as having been the consequence of COVID, where many of them quite probably were not, if the government had admitted that many of those who were dying were in fact people of great age who suffered from serious other diseases at the same time, then we wouldn't be in this state of panic, which allows us to be hurried into accepting these extremely drastic and damaging measures, which have, in my view, done permanent, probably irreparable damage to our society, and will leave our heirs and successors having to cope with the most enormous indebtedness for the foreseeable future.
So in terms of the scale of the national disaster, I mean, I would put it to you that 80,000 people is twice the number of people who died in the Blitz. And when we're talking about the age, for example, this comes up.
Let me just respond to that, if I may, because the number of people who die in an aerial bombardment of a city is over a certain period of time is going to be of a certain order. One of the most shocking things that I could ever say during this, and I said it from the very beginning, is this: every day in this country, 1,600 people die. Each of those deaths is a tragedy for those directly involved, and I'm a great John Donne person. No man is an island unto himself, and the death of any man diminishes me. And I'm not. But 1,600 people die every day, and some of those die of respiratory diseases, particularly during the winter months.
Well, okay, but just on that,
a lot of people don't seem to realise that it's a matter of classifying deaths, which in many cases would have happened anyway, or not that much later if there'd been no COVID at all. Jenny Harris, I think the Deputy Chief Medical Officer, saying quite early on, many of these deaths are deaths of people they're deaths of people with COVID, but that's not to say they're from COVID. But an awful lot of deaths were classified as being as a result of COVID, which were actually deaths of people who had COVID, who had several other serious conditions as well. And you know as well as I do, the average age of death from COVID in this country is 82. Which is slightly higher than the average age of death in general.
So on that,
here is a problem that if you do.
So here's some very important points again. Let me
because and feel free to do so, but I'll resist it. We've been quite successful in recent years in keeping old people alive for longer. But
okay, can I just answer a few of those points though, because otherwise
there is a difficulty. If respiratory diseases come along, then old people, particularly once you have cardiovascular conditions, will die in larger numbers because they have been kept alive successfully longer. It's a measure to some extent of our success. But to make out of this that what we're suffering is something similar to the so-called Spanish flu of 1918 is simply false. It isn't on that scale. It doesn't begin to approach that scale, and it doesn't justify the level of national panic and frenzy which has followed from it. No one's questioning that there are people who have died.
Okay, well, let me respond to some of those points just quickly.
If you're going to list excess deaths, you also have to list the very substantial numbers of excess deaths, and the research is still coming in on this, of people who died because they missed cancer appointments and treatments and all kinds of other things as a result of the general turning away from the health service, which was brought about by the panic spread by the government and large parts of the media, which kept people from going for vital medical treatment. And a very large number of non-COVID excess deaths can be recorded here as well. And you have to be careful to separate those. The statistical issues of this are very complicated.
But let me just come back quickly, Peter. Come on.
John Lee, the noted pathologist, has pointed out that it's a lot of the deaths which have been recorded as COVID may not actually have been so. And now we have this really strange thing, which is that both influenza and pneumonia seem to have practically disappeared from among us.
Well, they haven't. But let me just.
But the deaths from them are not being recorded. There's a difference, as same as in recorded crime and recorded deaths. There's a difference between recorded deaths and the actual facts of what's necessarily going on.
So, Peter, come on. I think it's fair I just have a little response to some of those points.
Go ahead.
The studies show, including one study from 49 nations in the OECD countries, these are advanced economies across the world, using COVID-19 data and economic data, found that those that locked down the swiftest and harshest tended to have a less bad economic impact as a consequence. That the problem with our case is the government locked down too late, allowing the virus to enter into bigger, broader circulation than would have been the case otherwise. That if they'd locked down earlier, the infection, the outbreak would have been less. The lockdown and the disappearance of consumer confidence would have been less, and we would have had, instead of having the worst death toll and the worst economic hit potentially in the whole of Europe, we've got the worst of all worlds at the moment, we would have had less of an economic impact and less people dying. So that's the point I'd make to you. Well, yes, you're right, there are excess deaths caused by flu, but there's not a precedent for those excess deaths, and that's despite these extreme measures. If we locked down quick, it would have been less severe, and people are dying 10 years before they should have done.
There are comparable precedents for those excess deaths, not exact ones, is my point. And they're not out of the same class. But your most fundamental assertion, and one for which you can produce no evidence because there isn't any, is that these shutdowns actually prevent the spread of the disease. I don't think anybody actually believes that the spread of the virus can be prevented, or it can be done. Even in the view of the advocates of these measures, is that it's delayed. The famous flattening of the curve, the squashing of the sombrero, which we were promised would be achieved by Mr. Johnson's shutdown. And the key statistic here, which demonstrates that this didn't actually happen, is that in this country the number of deaths peaked on April the 8th, and the shutdown was announced on March the 23rd, and I suppose one could assume it was underway within a couple of days. But let's assume that the shutdown actually began on March the 23rd. That's 7 days of March plus 8 days of April. That's 15 days. But the time from infection to death of coronavirus is roughly 4 weeks. So here's the simple fact: the peaking of deaths did not result from the shutdown. There is no evidence that these measures did what is claimed, and it's only because there is a ridiculous, unchallenged consensus enforced by what is effectively state broadcasting and frankly supine media coverage that the question isn't constantly asked: did these things work? No, they didn't. There's no proof that they worked at all. What we do know, absolutely for certain, is that these shutdowns have destroyed immense amounts of jobs and businesses, have reduced huge numbers of people to utter lonesome misery, have devastated the health service, have led to very large numbers of completely needless deaths of people who were deprived themselves of necessary medical tests and treatment. And we know this, and the price of them has been colossal. And it really is a case here of, yes, comrade, I see your broken eggs, but where is your omelette? Masses of broken eggs as a result of this policy, and the economic consequences. And of course, if I talk about the economic consequences, someone, I hope not you, will accuse me of caring only about money and not about life. But the economic consequences of this have been so catastrophic that people can't even begin to imagine the narrowness and misery of life in the future, which is going to be visited on people as a result of an economically, politically, and medically illiterate government imposing on the country disastrous measures which were wholly ineffective, totally unnecessary, and deeply damaging.
Because millions of people were already taking drastic measures. That point, though, that absolutely critical point about the economic consequences, the studies show that countries which managed to contain the virus, which took measures earlier on, had less of an economic consequence than this country. We've got the worst death toll in Europe, and also one of the worst economic consequences. If we looked at it, we wouldn't.
The problem with this country is that it's largely destroyed its manufacturing sector, which is something I think we could both agree on.
Yeah.
And therefore extraordinarily dependent on its service sector. And the measures which the government introduced were particularly devastating to a service economy such as we have. And if the economic results were worse, that's almost certainly the reason for it. Sweden, for instance, which we could discuss, but let's probably not, in general, has had some bad economic consequences from its non-shutdown. But this is largely because Sweden has maintained a fairly considerable manufacturing and export sector. And of course, with the rest of Europe strangling itself, if you have a manufacturing export sector, it will suffer from a loss of business from other countries. So you have to look at these things with a bit of care before you draw conclusions from them, and that's what I'm saying here. But I don't. If you either you think that these shutdowns are effective, or you don't. If you're going to say, well, actually, yes, the fact that the people were staying home before the shutdown voluntarily meant that the deaths peaked on April the 8th, which I don't think is true. But if you are going to say that, then you can't simultaneously say that the shutdown was beneficial. You would then be able to say that the Swedish approach of letting people make their own minds up would have been just as good. But in fact, the pattern of the virus is a pattern which is very often followed by viruses, and I don't believe there's any evidence at all that what we did in any way altered its progress. It did what it did, and then it faded away. And we currently have a largely statistical second wave, which the government is struggling by dispatching huge numbers of people into the country and advertising frantically for people to come and be tested, is struggling to maintain through statistical means. Owen, answer me a series of questions. What is lockdown supposed to prevent?
Lockdown is to stop people interacting with each other in close proximity, particularly indoors.
With the aim of preventing what?
Of infecting one another with a contagious illness.
The time from infection, which you say lockdown is supposed to prevent, the time from infection to death is approximately 4 weeks.
3 to 4 weeks.
How long? No, approximately 4. How long? Assuming which is probably untrue, that lockdown began the moment Johnson ordered it on March the 23rd. How long is it from March the 23rd to April the 8th?
But as I pointed out, lockdown. As I pointed out, millions of people started to isolate before they were told to by the government.
If the
infection rate came down,
lockdown were preventing
compulsory lockdown
were preventing infection, then it couldn't conceivably, given a period from infection to death of 4 weeks, it couldn't conceivably have led to a peak of deaths on April the 8th.
Of course it could, for the reasons I've explained. People, if you had less people interacting with each other because people were working at home, traveling less, socially distancing from each other, which took place significantly before the national lockdown, which is the only way of bringing down infections in a drastic way, then of course you'd have a peak on April the 8th.
I'm sorry, I've just won this bout and you haven't noticed.
But you haven't, Peter.
No,
by definition, the infection rate started to come down, but not anywhere near the amount needed without a compulsory lockdown. That's why we had a compulsory lockdown.
Infection to death is 28 days. The time from from Johnson's shutdown to the moment when deaths began to fall is 15 days maximum. What's the difference between 50 and 28?
Yeah, but the week before the lockdown, people in those 2 weeks beforehand, particularly a week before, millions of people voluntarily, at the instruction of the government, started to. So by definition, Peter, think about it. Of course, there were lower infections because people started to socially distance, wash their hands, and all the other things we were told to do, but not enough. That's why we had to have a drastic lockdown, which then would mean a sustained collapse in infections.
No, but this is a nonsense, because what you're saying is that without the lockdown, which you say created these results, without the lockdown, the infections were already being reduced. You can't have it both ways. No sign at all that they were going to be. And Fraser Nelson's written a very interesting article on the lack of overwhelming in our hospitals at the time, which simply didn't exist. And it only needs to be looked up to find. He got hold of the figures, and I commend it to you. Okay. But I can't. There's no point in going over this. What you're mistaking your opinion for a fact.
What do you think is going to happen next? So that's what I want to hear. Do you think the Conservative government will survive the turmoil that will come, even if mass vaccination happens?
I'm not sure our political system will survive the turmoil which comes when people realize just how much damage has been done to our society by these buffoons. When people find that they have no jobs, no prospects, they can't pay their rent, they can't pay their mortgage, their businesses have collapsed, their children have no future, they themselves have no chance of anything approaching a job resembling what they used to have, when they find out that the country is immensely poorer, that the National Health Service, which they bang their pots and pans for in March, April, and May, is a shriveled shadow of its former self, and so are all the other public services, from the railways to the schools. When they find out what has been done to them by these buffoons, I think there will probably be a considerable political revenge, and I would imagine the Conservative Party will take the brunt of it, but I don't think the Labour Party will escape because it failed to oppose it. And our political system may well enter a new and extremely unpleasant era, which I don't personally look forward to. I don't want to live in an impoverished country where everybody is justifiably angry. But I think that's why I fought against it so much. I never wanted this to happen. I simply wanted to prevent it. I wanted governments to act proportionately and sanely, and instead of as they have done. But I've failed. Those of us who've opposed this have failed. We've never reached more than a very small minority of the population. You've won. You've won in terms of public opinion. But what will happen now will be so unpleasant that it will render all this largely irrelevant. I've never seen debt on this scale. I've never seen the destruction of employment on this scale. I've never seen the wrecking of people's educations on this scale. I've never seen social dislocation on this scale. I've never seen the deliberate spreading of misery, particularly among the formerly healthy old on this scale, and the mistreatment of people in care homes and the separations of families. It's appalling. And as I say, there will be a price to pay, and it won't necessarily be a rational price. And I can't see that the Conservative Party will survive it, because people will undoubtedly blame them, as they blame them for the much smaller catastrophe of the exchange rate mechanism for many years afterwards. I think they're settled with that, and I think they probably know it. But the whole political system is what is in danger. The whole stability of our society is in danger. This is a colossal thing, and we will be paying for it for a very long time indeed.
Well, on that cheery note, thank you very much, Peter.